This is Talk Business and Politics with Roby Brock.
I'm Roby Brock. Welcome to today's Talk Business and Politics Daily. Here are your top stories of the day.
Representative Rick Crawford has concerns on health care reform in an exclusive interview with Talk Business and Politics this afternoon. Crawford said he was still a no vote on the GOP's Ryan Trump health care plan. He said he thinks the measure is still too government-centered, and he contends the legislative process has been conducted in a way that will result in unnecessary legal challenges. More at talkbusiness.net. Governor Asa Hutchinson signed into law the controversial Guns on College Campus bill. It allows for concealed carry permit owners to carry their weapons on college campuses and in other areas with proper active shooter training. There is still expected to be changes to the law in this legislative session to carve out an exemption for UAMS and the state hospital. Finally, more concerns over President Trump's proposed budget. Airport officials, arts supporters, and those that provide legal aid all contend that federal budget cuts will cripple funding for their programs in Arkansas.
And you can keep up with these top stories just like these each and every day on our website at talkbusiness.net. After this break, Dr. Joe Thompson, he heads the Arkansas Center for Health Improvement. He's also Arkansas's former Surgeon General. Guess what we're going to talk about? Health care when we come back.
Arkansas Electric Cooperative Corporation provides electric energy across 2/3 of Arkansas. This is an exciting time in our energy history, with incredible progress being made in renewable energy and storage technologies. As our energy portfolio continues to diversify, we'll maintain an all-the-above strategy to provide reliable and affordable electricity. Ever since the first light bulbs were placed in our members' homes, the electric cooperatives have been the solutions provider for our members, and we want to continue that well into the future.
Each day, the promise of our nation begins again. Arkansas and America, moving forward. I help make that promise a reality. It's not for everyone, but people everywhere depend on us. Trucking delivers, or everything stops. And that's what drives me.
All right, welcome back. I am with Dr. Joe Thompson. He is the president and CEO of the Arkansas Center for Health Improvement, ACHI. We got all kinds of nicknames for you.
Glad to be with you.
Let's talk about the Ryan Trump plan. It has changed since earlier in the week when you and I previously talked. Changed to address Medicaid, changed to address maybe these premiums for some older workers here. Do you contend that the bill is still flawed?
I think the fundamental requirements for insurance to work is not contained within the current plan as proposed. You know, when you have car insurance, you don't get to buy car insurance after you have a wreck. You don't get to buy homeowner's insurance after the tree falls on your house. But we're wanting to say you can't have any limits on pre-existing conditions, but you can buy it whenever you want to buy it. And that just won't work in the insurance world.
Yeah, so what would have to happen to make the bill more palatable? Would the mandates need to be put back in that you have to buy the insurance?
Well, the Affordable Care Act, or Obamacare, and it has its flaws, but what it tried to do is give a sliding scale of tax credits down the income ladder to help people buy health insurance. This plan takes away that sliding scale and says you get more tax credits the older you are and the more affluent you are. So this really is upside down when it comes to encouraging people to buy health insurance on the open market.
I've asked this question before. I will get branded a socialist for asking this question, but why not do Medicare for everyone and then allow employers and private health insurance to fill in gaps with supplemental health insurance where you get everybody in the system and that risk pool is spread across? Does that make me a communist? Does that make me a socialist?
I'm not going to comment on your political allegiances, but essentially those strategies get everybody in the pool, and therefore you don't have to worry about pre-existing conditions. We're trying to use a commercial marketplace, and you've got to have either very stiff penalties or very high incentives to have everybody be willing to participate.
So it can be done through the free market or the private market, but it just has to have that caveat in there is what you're saying.
Almost every other developed country does it a different way, not in the open market as we're trying to do it, but Americans want to do it our own way, and we're going to keep trying. We're going to keep trying.
Let's talk about two Arkansas projects that you've been highly involved with. One is the Medicaid expansion, the private option, now known as Arkansas Works, and the Payment Improvement Initiative. Tell me, I guess, a little bit about what those two plans have done, and could they be a model to maybe take health coverage a little bit further at the national level?
Well, let's start with the Payment Improvement Initiative. This is now a multi-payer effort. Blue Cross, QualChoice, Centene, Medicaid, Walmart, everybody's in it together. and we're trying to change the incentives on the healthcare system to deliver higher quality, more efficient care at a lower cost. And it appears to be working. Medicaid has paid out shared savings, meaning that our primary care workforce has actually shared in savings that they helped make to the system by avoided hospitalizations, emergency room visits, and so forth. We're seeing other states, Tennessee and Ohio, start to pick up what we did first. And I think that was one of the important things about the Affordable Care Act. Nobody focused on cost containment. They just focused on expansion.
Right.
Now, we did expansion in a different way than every other state by taking the Medicaid dollars and buying private commercial coverage. And unlike what you hear on the news, double-digit rate increases, 20% higher, going through the roof, our rate increases have never been more than double digits. For the first 3 years, they were less than 6%. And that's because we put a big guaranteed purchaser Medicaid into the individual marketplace to help stabilize the risk pool.
There was an attempt to have higher premiums. They just didn't get through the insurance commissioner on that.
We have aggressively managed those rates, the insurance commissioner has. And I think going forward, the model that we used for Medicaid expansion is actually, again, paying attention to those insurance rules of getting everybody in the same bucket so that the risk is spread evenly across the whole
So you're telling me
waterfront.
soon my insurance premiums will be going down. That's what you're telling me, right? I'm just on the record right now.
On the record, your insurance premiums are going up less than any other state in America right
Okay.
now because of what we did with Medicaid.
All right, now last question for you. Prediction, what's going to happen on that House vote on Thursday?
You put me in a tough spot. You've got those who want to improve the Affordable Care Act. You have those that, on the opposite end, that don't want to do anything. And we'll have to see where the pendulum swings tomorrow sometime around 1 o'clock.
What was that?
I think it was heads.
I think it was Dr. Joe Thompson. We almost got an answer from you on that. We will know soon enough, though. Thank you
Great.
very much, my
Thank
friend.
you very
Appreciate
much.
you. All
Thanks.
right. Thank you for watching. That is all for today's Talk Business and Politics Daily. I'm Roby Brock. We'll see you next time.